and then we want to give IV fluids, that's drip. We want to, if there's fever, of course, we want to give things that will bring down the fever, and then rather than oral drugs that was used if the patient was not sick, this time around, we want to start with injections, IV drugs. So, we start with IV drugs when the patient is now feeling better, when things like vomiting has resolved, and then the patient is feeling better, the fever has gone down, then we can now convert the patient to oral drugs, and then we complete it for 14 days, and then, of course, life goes on. So, that's for the treatment. Now, the very important part of this discussion that I want us to pay very good attention to are the complications of PID. Now, what are the complications of PID? When we talk about complications, what are those things that PID can do, the harm that it can cause in us? Now, the commonest, in fact, the most fearful one for anybody is infertility. Now, the most important organ that it affects is the fallopian tube. And don't forget, in the introduction, I said the fallopian tube is the site of fertilization. That's the male sperm and the female egg, they meet in the fallopian tube. So if the fallopian tube is not functioning well, the pregnancy might not occur. Sometimes when these infections, when they occur, and then we treat them, they can leave some scars in the fallopian tube. So, because of these scars, they can cause something we call ectopic pregnancy, because that scar can now cause a blockage in the fallopian tube, and then it will now prevent the fertilized egg from going into the womb to go and settle and implant into the womb. So because of that blockage, it will settle in the fallopian tube and cause ectopic pregnancy. And I'm sure we all know that ectopic pregnancy is a very dire emergency that can kill a woman. So, infertility is a common complication of ectopic. Sorry for the break in transmission. So I said infertility, ectopic pregnancy, then other things like pelvic. I don't know how to explain this. It can affect the whole pelvic structure. We call pelvic cellulitis. Then it can form abscess. That's collection of pus. Now, when PID affects the fallopian tube, usually it will cause pus formation in the fallopian tube, and then after a while, the pus will go, and then it will now form water in the fallopian tube. Any of these, be it pus or water in the fallopian tube, will destroy the tube, so it will not allow the tube to function well, and that's why it will cause infertility. Now, after a while, that pus can now come out of the tube and come into the pelvis itself and now cause abscess. There will now be accumulation of pus in the pelvis, and then that can make one very, very ill. And then, of course, the illness can now spread to the other part of the body, and then even cause infections in other parts of the body. Other complications it can cause is chronic pelvic pain. What we mean by chronic pelvic pain is pain that this woman will just continue to complain about lower back pain. Not just lower back pain, but pain generally in the pelvic area. And it goes on for a long time. It is something that is very, very difficult to treat. So, it's one of the complications of PID. Of course, other things it can cause, there's something we call tubo-ovarian abscess. So, that is abscess formation. Abscess is just a collection of pus. The abscess formation will now involve the fallopian tube and the ovary. And when this happens, be it pelvic abscess or tubo-ovarian abscess, we cannot treat with drugs. It is with surgery. So you can imagine that PID can, as in one of the treatments of PID, if it gets complicated, can involve surgery. Yes, we are getting to the end of this. So, the last thing I'd like to talk about is the prevention of PID. How do we prevent PID? The first thing, because we know that most of them are sexually transmitted, usually what we preach is ABC of prevention of STDs. What is A? Abstinence. Of course, if you are not married, you have no business with sex. That's abstinence from sexual intercourse. B is be faithful. If you are married, or even if you are not married, whatever, be faithful to one sexual partner. And then C is correct and consistent use of condom. So that is what medically, that's what we talk about. The ABC of prevention of STDs. Then other things we can do is recognition of signs and symptoms of PID. Once you have any of these symptoms or signs that I've talked about, it is not something to keep quiet about or to be doing self-medication about. Oftentimes when we get these patients early and we treat, the treatment is usually as it's something that is curable and then everybody goes home happy. But if we don't treat it well and it becomes chronic, then it becomes a bigger headache for both the doctor and the patient. Now, like, a lot of people don't seek treatment early. We would have tried all sorts. Agbojedi, and the likes. And then when it now becomes something chronic, and then, of course, and it starts coming down with complications, that is when we now present. Usually, sometimes it's already too late. And there's little that we can do. So, early recognition of signs and symptoms of PID and early treatment. So it's not just recognizing it, having the correct treatment. And then we need to be compliant with drugs. A lot of patients, when we tell them, you're going to use this drug for 14 days, they will use it for a few days. And now the trick to this is that once you use it for like 2-3 days, you start getting better. So a lot of people will stop the drugs after a few days. Fine, you could get better, but it's not a curse, it will come back. And when it comes back, it might come back worse. So we need to be compliant with medications. When they tell us, use this drug for 14 days, please let us try as much as possible to finish the drugs, even if the symptoms have disappeared. And while we are on the drugs, we should abstain from sexual intercourse so that we do not reinfect ourselves. And of course, we must encourage treatment of sexual partners too. When we are treating PID, we do not only treat the patient, you must treat the patient and all the sexual partners. I'm talking about this because, of course, we treat young unmarried people too. And sometimes they could have more than one sexual partner. So, it's not just treating the patient alone, it's treating the patient and all the sexual partners. And this also involves those of us in polygamous marriages. If we have to treat one of the wives, then we must treat the husband and all the other wives in the marriage. If not, we have not done anything. The husband can come back to reinfect the patient. That's if he is already infected too. So we must treat the patient and all the sexual partners. And then, of course, we usually encourage people to come back for follow-up. Even after the medications have been used, sometimes ideally we should repeat the test to ensure that the patient has been cured, of course, and then counsel the patient on ways of preventing a recurrence of this. So, with these few points of mine, I hope I have been able to convince you and not confuse you about what PID is all about. Thank you. So, do you have any questions? I will be glad to answer them.
Assalamu alaikum warahmatullahi wabarakatuh. For your very interesting lecture, ma. My question is this: I don't know if this probably has anything to do with PID, but what can okay, I know someone who gave birth and she missed her period for like the first 6 months. That's probably due to the breastfeeding hormone and everything. But afterwards, when the period came back, it became irregular. And this is someone that she always has her periods, on the clock of the cycle, 28 days every time before she got pregnant. But since she gave birth, the period sometimes 28 days, sometimes 30, sometimes 24, sometimes 26, and like that. But the period is not heavier, it is not painful. Well, she used to have menstrual pain before she got pregnant, and it actually even seems to have reduced. So the question is, what do you think might be wrong? Could it be a PID or something?
Answer to question 1. As long as the cycle length is between 21 to 35 days, then it is normal. What you have even painted is not likely to be PID. If she is that worried, she may need to see a gynecologist for Roper evaluation. But sometimes, cycle length can change without any underlying problems.
Please, I want to know if ovarian cyst is also an example of PID. And if so, is it curable? Is it medically curable? Thank you.
Answer to question 2. Ovarian cyst is not a feature of PID. It is another entity itself. By Allah's grace, we shall discuss it too soon. Ovarian cyst is very curable depending on the type.
Question 3. Thanks so much, ma'am. My own question is on the vaginal discharge. As you've rightly said about how a normal vaginal discharge should be. If the vaginal discharge is pure white, can it be a symptom of PID?
Answer to question 3. Yes. If the discharge is plenty and foul smelling. But if it is white and non-foul smelling and not plenty, then it is most likely normal discharge.
Question 4. Thank you, ma. My question is, perchance, can one get pregnant, even with the presence of PID, without the person knowing she is infected? And, what harm can it cause to the fetus?
Answer to question 4. Well, generally, PID prevents pregnancy, so it's not likely. But we don't say never in medicine. With virginity, pregnancy is possible, but with PID, pregnancy is unlikely.
Question 5. Can PID be contacted from toilets if shared with an infected person?
Answer to question 5. No, ma. PID cannot be contacted through toilet. Those are some of the myths associated with PID. They aren't true. Of course, this is not to downplay the importance of good toilet hygiene.
Question 6. Can wearing pants make one contract PID if proper care is not taken?
Answer to question 6. Wearing pant is not likely to make one contract PID.
Till next time, when we shall be having another interesting program here on PMG platform, I say a very big thanks to all and sundry that took active part in today's program. And to all our silent members, we implore we make the platform active and lively. I still remain yours in Islam, Sakina Abdulaziz Eligbede. I love you all.
To join Precious Mothers Guild PMG platforms, contact +2 3 4 9 0 6 0 6 4 7 0 0 8.